Ischemic heart disease.
Ischemic heart disease, it also termed as coronary artery disease, describes a group of clinico-pathological syndromes characterized by myocardial ischemia, in which an imbalance between myocardial blood supply and myocardial demand, resulting in partial ischemia of the myocardium. Classification of ischemic heart disease. We may be classified ischemic heart disease into two main groups, which are chronic artery disease and acute coronary syndrome. Chronic artery disease can be stable angina, and acute coronary syndrome can be subclassified into unstable angina and myocardial infarction. Myocardial infarction can be divided according to the echocardiogram into two groups: ST segment elevation myocardial infarction STEMI and non-ST segment elevation myocardial infarction NSTEMI. Types of angina. Angina can be stable angina, unstable angina, decubitus angina, Prinzmetal angina or vasospastic or variant angina, and cardiac syndrome X. Stable angina is defined as chest pain repeatedly triggered or induced by specific events such as physical exertion, psychological stress, heavy meals, and exposure to the cold. It usually relieved within 20 minutes of rest or resolves with administration of nitrates. Unstable angina. Angina that changes in intensity, character, or frequency is termed unstable. It occurs on minimal exertion or at rest. Vasospastic angina. A sudden coronary artery spasm that leads to a reduction in coronary blood flow, thus causing severe chest pain. Angina at rest is called vasospastic, Prinzmetal's, or variant angina. This type of angina occurs at rest, rather than on exertion, without any initiating factors. Ischemic heart disease is a disease in which the blood supply to the heart muscle is partially or completely blocked. The heart muscle needs a constant supply of oxygen-rich blood. This blood is delivered by the coronary arteries, which branch off from the aorta just after it leaves the heart. Coronary artery disease, in which one or more of these arteries narrow, can interfere with blood flow, causing chest pain. In developed countries, coronary heart disease is the leading cause of death in men and women, accounting for about 1/3 of all deaths. Ischemic heart disease, in particular atherosclerosis of the coronary arteries, literally hardening of the arteries, involving fatty deposits in the walls of the arteries, and can progress to narrowing and even blocking the blood flow in the artery. Mortality increases with age and is generally higher in men than in women, especially between the ages of 35 and 55. After the age of 55, the mortality rate for men decreases, while for women it continues to rise. Between the ages of 70 and 75, the mortality rate for women exceeds that for men of the same age. Causes of coronary heart disease. CHD. Coronary heart disease almost always develops due to the gradual accumulation of cholesterol and other fatty substances, so-called atheromas or atherosclerotic plaques, in the wall of the coronary artery. This process is called atherosclerosis and can affect many arteries, not just those of the heart. The most common cause of an abnormal decrease in blood flow to the heart is atherosclerosis. Other causes of an abnormal decrease in blood flow to the heart include spasm of the coronary artery, which may occur spontaneously or as a result of the use of certain substances such as cocaine and nicotine. Endothelial dysfunction, i.e., a condition in which the coronary artery does not dilate in response to the need for increased blood flow, e.g., during exercise, resulting in blood flow not meeting the needs of the heart. Congenital malformations such as anomalies of the coronary artery. Coronary artery dissection, rupture of the inner lining of the coronary artery. Systemic lupus erythematosus, inflammation of the arteries, arteritis. A blood clot that has traveled from the chamber of the heart to one of the coronary arteries. Physical damage due to trauma or radiation therapy. Risk factors for coronary artery disease. Some factors that influence the development of coronary heart disease in a particular patient cannot be changed. These include elderly age, male gender, a positive family history of early coronary artery disease, that is, close relatives who developed the disease before age 55 for men or before age 65 for women. Other risk factors for coronary heart disease can be changed or treated appropriately. These factors include high levels of low-density lipoprotein LDL cholesterol in the blood, see dyslipidemia, high levels of lipoprotein A in the blood, low levels of high-density lipoprotein HDL cholesterol in the blood, diabetes, smoking, high blood pressure, obesity, lack of physical activity, dietary factors, high levels of C-reactive protein CRP in the blood,